Hello, and thank you for joining the session. My name is Melissa Bates, and I am a Senior Program Analyst for the Pathway to Excellence program. In this session, I will detail the changes to the Pathway Framework for Positive Practice Environments. With that planned topic, more specifically, we will focus on exploring the evidence-based enhancements to the 2024 Pathway Application Manual criteria. The new criteria for the 2024 Pathway Manuals will become effective, meaning that when an organization submits their Pathway Standards document as of February 1st, 2025 cycle, they will need to use the 2024 Manual criteria. Generally, it will take 2 years to revise the Pathway Manual. Here we see a high-level timeline for the revision. The Commission on Pathway to Excellence, or COPE, drives the process, starting with looking to the current literature and scanning the environment. From this, initial drafts of elements of performance, or EOPs, are prepared. This slide really simplifies the process. There is much back and forth and discussion, revision, and approvals along the way. In the late fall of 2022 into early 2023, we sought feedback on the draft EOPs from experts in the field and from subject matter experts within the American Nurses Association enterprise. Additionally, we had a stakeholder comment period where CNO, directors of nursing, and pathway program directors from designated and applicant organizations could likewise provide feedback on the drafted EOPs. After incorporating this feedback into the EOP drafts, the near final version was posted for the public to comment on. Through this process, the EOPs were strengthened and made more relevant. Thank you to all who contributed. In the summer, the manual, once approved by the COPE, was prepared for publication in October 2023. Here we see a snapshot of the EOPs of the 2020 as they were in 2020, 2016, and the 2024 manuals. The COPE did not do blind or indiscriminate chopping and removing of EOPs. Rather, there was surgeon scalpel precision. There were some EOPs considered for removal that in the end, based on recent studies that confirmed them still as relevant and necessary, such as support for floating when working in areas outside of your primary area, are really still not universally in place at organizations. The COPE decided to keep that EOP. Some high-level themes you will see as we look at the new EOPs are assessing effectiveness, not just maintaining status quo, but instead improving, changing course if that is what the assessments point to, elevating the culture, and effective closed-loop communication with follow-through. We also made a shift from using the term shared governance to shared decision-making structure. The term shared decision-making structure is more inclusive, and Pathway believes that shared decision-making is foundational. If shared decision-making does not exist, then the shared governance committees and councils will never be effective. As the Pathway framework has a standard for well-being, it was essential for the manual work to include review of the National Plan for Health Workforce Well-Being. The National Plan is prepared by the National Academy of Medicine, or NAM, Action Collaborative on Well-Being and Resilience that consists of more than 200 organizations committed to strengthening the health workforce and reversing burnout, with the intent of promoting clinicians' well-being through prescriptive measures that would ensure a safe work environment and maintenance of a work-life balance. Additionally, the plan addresses the actions needed to improve healthcare and health systems at the organizational level so that health and care are delivered in an equitable and trusted manner. The vision of the plan is that patients are cared for by a health workforce that is thriving in an environment that fosters their well-being as they improve population health, enhance the care experience, reduce cost, and advance health equity, therefore achieving the quadruple aim. As we look at the new elements of performance today, notice the connection to the 7 priority areas of the NAM National Plan for Health Workforce Wellbeing, which are create and sustain positive work and learning environments and culture, invest in measurement assessment strategies and research, support mental health and reduce stigma, address compliance, regulatory, and policy barriers for daily work, support mental health and reduce stigma, engage effective technology tools, institutionalize well-being and long-term value, recruit and retain a diverse and inclusive health workforce. Many of the new EOPs are derived from the recommendations in the national plan. Pathway Director Dr. Christine Pabico and past ANA President Dr. Ernest Grant published an article in the Nursing Management Journal on the national plan and the pathway framework as a means to achieve the plan's recommendations. This article link can be found in the resources for this presentation. We are excited about the synergies between Pathway and other national entities that focus on components of the Pathway framework, including the Leapfrog Hospital Survey, which is an annual assessment of hospital safety, quality, and efficiency performance measures. Starting in 2021, the ANCC Pathway designated hospitals participating in the Leapfrog Hospital Survey have the opportunity to earn full credit for the National Quality Forum endorsed Safe Practice Number 9, Nursing Workforce, when achieving the designation under the 2020 Pathway Manual standards. We were sure to consider the Leapfrog survey when revising the Pathway safety criteria to maintain alignment with Leapfrog. And new EOPs around diversity, equity, inclusion, and belonging of staff and reporting discrimination in the workplace are in step with recommendations from the ANA programs and other standards, including Healthy Nurse, Healthy Nation, and American Nurses Foundation for Wellbeing, ANA for Quality, and ANA Leadership Scope and Standards for the Leadership Standard. Overall, all the standards, both new and continuing, are based on evidence. Here is the Pathway to Excellence framework for positive practice environments, highlighting Standard 1, shared decision-making. Part of achieving Pathway to Excellence designation means that the organization has an established shared decision-making structure as the foundation for involving direct care nurses in decisions that impact their practice. The critical concept of shared governance is shared decision-making between the direct care staff and leaders as a way to foster ownership and accountability. Fostering interprofessional collaboration into the shared decision-making structure is equally integral in building cohesive and highly effective teams. Interprofessional decision-making is valuable when addressing ethical concerns, promoting community health, and integrating new technology. When nursing staff feel heard and have input into decisions that influence care delivery and their practice environment, their job satisfaction increases. They become more engaged, fully own their work, and feel fulfilled. One new EOP was added to the standard. An additional concept was moved from another standard into shared decision-making to emphasize the shared decision-making aspect of the EOP. Shared decision-making permeates all the pathway criteria. Nurses, along with their interprofessional colleagues, having a voice in the decisions that impact their practice is vital to creating a positive practice environment. As you see the new concepts on the screen, I just wanted to note that these are abbreviations of the elements of performance. The concept for EOP 1.2 is that the organization assesses the effectiveness of the shared decision-making structure. As I mentioned earlier, this manual has a recurring theme of the importance of pausing to consider and assess, to determine if the current ways are working or not, and what staff needs are. Certainly, when a healthcare organization wants to develop and implement a shared decision-making structure, they should spend time in the literature identifying potential areas of vulnerability and known pitfall areas. Additionally, conducting a thorough self-assessment will lead to smoother planning, implementation, and evaluation of the new program. But the organization cannot assume the shared decision-making structure they initially set up will always be what works best for their teams. Pulse checks are vital to determine the current state of the shared decision-making structure for continued success, improvement, and evolution. There are multiple avenues and tools to conduct formal and informal assessments of the shared decision-making structure. Two validated tools and measures are the Varin Professional Governance Scale and the IPG Council Health Guidelines. Additionally, the National Database of Nursing Sensitive Quality Indicators database, the Practice Environment Scale of Nursing Work Index, and Hospital Consumer Assessment of Healthcare Providers and Systems are other ways to assess the shared decision-making structure. Pathway is not prescriptive on the method you must use for this assessment. This methodology of how the shared decision-making structure is going in relation to the set aims of the work can be related to using the plan, do, check, and act methodology. It is imperative to determine at regular intervals whether or not the shared decision-making structure is making a positive impact within the organization. Leadership members within the Pathway to Excellence designated organizations embrace all essential elements of a positive practice environment and exhibit role model behavior for the team. They foster collaboration among staff and are champions for a shared governance environment. CNOs and nurse managers alike actively engage direct care nurses for input in areas such as resource allocation and cost management. Successful transformation of an organizational culture requires alignment of vision, mission, and goals throughout the organization. Nurse managers are essential in creating the local culture for the frontline staff. With the importance of their role, it is critical for them to be provided with role-specific orientation and opportunities to increase their core knowledge and role competency. This includes leadership development activities and feedback from colleagues and nursing staff. As leadership champions within the organization, the CNO and nurse managers are accessible and support direct care nurses during times of organizational change. Strategies are in place to retain CNO and nurse managers and develop nurses for nursing leadership roles through succession planning. Shared decision-making is a priority through periods of both planned and unplanned organizational change, as is maintaining a positive practice environment in the event of executive leadership transition. We examined the American Nurses Association Nursing Leadership Scope and Standards of Practice and are happy to share that nearly 2/3 of the Pathway EOPs in the 2024 manual across all 6 standards align with the ANA Nursing Leadership Scope and Standards of Practice. While not an EOP, there is a new item in the organizational overview requiring a description of how the organization incorporates the ANA Nursing Leadership Scope and Standards of Practice into the preparation and continued development of the nursing leadership team. There are not any completely new concepts in the leadership standard. One EOP on succession planning was brought over to the standard to make room for a new EOP in the professional development standard. And while there are not any new EOPs in this standard, we know how much nurse leaders struggled through the uncharted territory of the pandemic. And there is a focus and new EOP in the well-being standard on support for leaders. We will look at that in a bit. Standard 3 is safety. Pathway to Excellence organizations protect the psychological and physical safety of nurses, staff, and patients through safety policies and essential processes. It is essential to create an environment where staff feel safe to express their ideas and concerns and to report errors without fear of negative consequences. A safe environment also includes measures to create a culture free of incivility, bullying, and workplace violence. Staffing that is correlated to safety must reflect effective team composition and balanced workloads created with input from staff. In addition, in order to proactively mitigate fatigue and burnout, which impacts care delivery and patient safety, strategies must be in place to enable staff to consistently take their meal and rest breaks. There are two completely new concepts in this standard, and one concept that we have pulled on the thread further to make a new EOP in the safety standard. The concept for EOP 3.6 is that nursing leadership addresses long-term staffing concerns expressed by the direct care nurses, and associated strategies are communicated back to the direct care nurse. Effective communication is key to safe patient care. Lacking communication has been linked to medical errors, nurse turnover, and low morale that increases stress, job dissatisfaction, and reduces quality of life. Therefore, nurse leaders must be inviting and welcoming to hear their nurses' concerns related to long-term staffing. The leader should listen actively, practice positive body language, rephrase back any comments to ensure understanding, all while being sure to avoid negative messages. As with any concerns expressed, it is imperative to close the communication loop and relay back to the nurses strategies put in place to address the concerns. When a nurse doesn't feel heard or that concerns are addressed, they may hesitate to raise future concerns, which would be a truly unsafe scenario. The graphic here is from the American Hospital Association on closed loop communication. This method can be used with patient and family interactions, between interprofessional team members, and between nursing leaders and direct care nurses when discussing long-term staffing concerns, as with other conversations as well. The direct care nurse is the sender, sharing their concern. The nurse leader needs to be open to and invite their expression of concerns. Part of being welcoming is that their nurses know what to expect in this circle of communication. Once the direct care nurse has shared their concerns, say a PACU nurse's concern is that there is a pattern of getting jammed up and behind with sending post-op patients to the units on Thursday afternoons after surgery. This nurse thinks having an additional nurse for a 4-hour window on this shift would help alleviate the problem. After listening without interruption, the nurse leader needs to relay back what they have heard, allowing the direct care nurse to clarify as appropriate and verify understanding. In the midst of this conversation, the leader needs to express what they have heard, that they have heard what was shared and what comes next. Not that they are solving the problem on the spot necessarily, but that the issue will be further explored and that they will be sure to report back to the nurse. This is so key. If the direct care nurses experience that nothing seems to happen when they share a concern once or twice, They may stop raising vital concerns altogether. Whether the suggested course of action from the nurse is the solution in the end or not, the nurse leader can come back and share the results of the deeper dive and look at the concern. Perhaps a nurse is added to the schedule for 4 hours on Thursday afternoons, as was suggested, or there may be some other solution, from adjusting the surgery schedule to increasing ancillary staff to lessen the burden in the PACU. Either way, the nurse leader needs to close the loop and keep the team informed. Effective nurse leaders are empowered and supported to address staffing concerns raised by their staff. This enables them to proactively communicate and establish a culture where nurses feel supported to raise long-term staffing concerns, and in turn, their nurses can be confident their leader will provide the appropriate resources to address these safety concerns. The concept for EOP 3.9 is that nurse managers create a culture where meal and rest breaks are planned and consistently taken by their direct care nurses. This concept was pulled straight from the national plan. Research shows that when employees take their lunch breaks, their engagement and productivity is enhanced. For many, this is easier said than done. Some feel judged for taking breaks or think there just is not time. Their patients will be left hanging with no coverage. Taking a meal break can decrease stress, increase feelings of productivity, and help feel less burned out too. Other breaks are important as well. It is all about the culture. The leaders set the tone and example here. They help clear the way for staff to take breaks. Staff can be encouraged to take breaks when there are hospitable places to do so. Be sure the break room is welcoming, with enough seating and well-equipped with microwave, fridge, and coffee. Also, encourage social interaction by making cards and games available. Additionally, are there spaces for employees to catch a short walk or sit on a bench outside? These breaks bring such needed refreshment, fresh perspective, and mental focus. Thus, this EOP is in the safety standard, but there is certainly relevance to the nurse well-being as well. This chart is from the American Nurses Foundation Workplace Survey in 2022, affirming that a majority of nurses surveyed, 61%, did not feel they have adequate time for uninterrupted meals or breaks. We know that nurses that are physically fatigued are more error-prone in the provision of patient care. Thus, nurse managers need to be supportive of built-in time for direct care nurses to refresh and recharge. EOP 3.11 calls for a culture where staff can feel safe to report discriminatory behaviors. Reported concerns are addressed, and follow-up is provided to the staff that report the concerns. This concept is derived from legal statutes. According to the U.S. Equal Employment Opportunity Commission, or EEOC, employees have a right to complain about treatment that they believe is illegal job discrimination. You cannot punish employees, treat them differently, or harass them because they report job discrimination or help someone else report job discrimination, even if it turns out that the conduct was not illegal. Okay, so why have an EOP if it is codified in the law? The EEOC reports that only 30% of employees that experience harassment based on gender, race, national origin, disability, or other protected classes make complaints. Another meta-analysis likewise found that fewer than 1/3 of employees even spoke with their supervisor about harassment or discrimination. Consistently, the reason for not reporting was fear or expectation of retaliation. Another reason is inflexible reporting options for victims. As often, a confidential or anonymous reporting option will be preferred. Further, a toxic culture will equate to low reports. Here too, we see the theme of effective communication. Trust is needed to feel safe to report. Trust to know that they will not be retaliated against, and trust that their concern will be addressed. By keeping the person that was brave enough to report informed, that trust is earned. Organizations must assess their culture, policies, and processes for reporting these behaviors. When gaps and barriers are found to reporting, the meaningful work to elevate the culture in this regard should commence, being sure to include the views and perspective of those who have experienced discriminatory behaviors in the past. The organization must foster zero tolerance for discriminatory behaviors and empower their employees to speak up when unfair treatment occurs without fear of retaliation. It is essential for staff to be confident that their leaders will take action to ensure a safe practice environment. Now we look at Standard 4, the quality standard. Quality is central to Pathway to Excellence designated organizations' mission, vision, goals, and values. Integral to the values and culture is the promotion of diversity, equity, inclusion, and belonging. Continuous quality improvement in the delivery of person-centered care and efforts to improve population health are promoted. Quality initiatives in Pathway to Excellence organizations are evidence-based while supporting innovation and new ideas. They are also developed or enhanced based on benchmarks and with interprofessional input. These initiatives include developing and revising patient care standards and policies, as well as staff education. There are a couple new EOPs in the quality standard. EOP 4.9 calls for the organization to promote a culture of diversity, equity, inclusion, and belonging, or DEIB, and how the organization assesses the effectiveness of the associated strategies to promote DEIB. This concept was added to the 2020 Pathway Manual as a clarification, as a new item in the organizational overview in early 2021. After review, analysis, and consideration of the thoughtful responses provided by Pathway applicant organizations, the Pathway Commission refined and elevated the concept for the 2024 manual. Some Pathway commissioners, Commissioners Morrison and Hauk, and Pathway staff co-authored an article published in October 2021 edition of the Nursing Administration Quarterly on the alignment of the Pathway framework to diversity, equity, and inclusion. Some imperatives from that publication include the importance of organizational commitment, as demonstrated by incorporating diversity, equity, and inclusion into the mission, vision, and goals. Having set goals for DEIB initiatives with leaders accountable for each goal. Having a DEIB working group with leaders identified and accountable for communicating associated outcomes. A mechanism for identifying emerging DEIB needs and areas of concern, and numerous media formats to share with the public the commitment to DEIB. In terms of organizational culture, the organization should compile and track diversity data, be sure that diversity is represented at all levels of staffing, provide feedback and safe spaces to discuss DEIB issues in the workplace, celebrate diversity of ideas and people, have a professional practice model, and provide management and leadership training programs that support DEIB. The third pillar is the necessity to have organizational structural empowerment, meaning there is a system for shared decision-making that promotes accountability, partnership and ownership, and equity. There should be structured processes for recruitment, promotion, and evaluation that supports DEIB goals. There should be a mechanism for the recruitment of a diverse candidate pool And the organization should routinely review policies to ensure they support DEIB initiatives and strategies. As I mentioned, we analyzed responses to the organizational overview, and through that, we found and identified a couple pathway designated organizations that really stood out for their DEIB culture. We have co-authored an article in Jonah with them as they share strategies and initiatives they have in place. Additionally, there is a webinar where we share with them as well. The sources I have mentioned can be found in the reference list provided for this presentation. Organizations must prioritize a culture of respect and inclusion where employees feel seen, heard, and accepted at work, which fosters creativity, different perspectives, understanding, and collaboration that supports and makes possible excellent patient care. The concept for EOP 4.10 is that organizations encourage sharing of new ideas and supports implementation of innovation in the workplace. This EOP's origins go way back to the saying attributed to the ancient Greek philosopher Plato that goes, "Necessity is the mother of invention." A need or problem encourages creative efforts to meet the need or solve the problem. How can leaders and organizations encourage the sharing of new ideas? They should identify gaps and include nurse leaders on executive teams and board operations committees, etc. Get the nurse perspective out there, part of the conversations, and offering solutions. They should embrace nurse-led experimentation within the health system. Because of their proximity to the patients and their knowledge of clinical challenges, nurses are ideal innovators. And to have a spirit of innovation at the organization, the C-suite should commit to a pilot-driven culture and nurse-led solutions and creating clear, actionable processes that nurses can use to submit ideas for vetting. I want to highlight the ANA Innovation website and work. The website has many great resources, podcasts, blogs, and including the Innovation Awards, lounges, nurse pitch articles, Innovation Accelerator, and the Innovation Sandbox. Also, another plug for the Pathway Award. The ANCC Pathway Award honors a project proposal in a Pathway to Excellence designated organization that creates a positive practice environment using innovation and technology. This EOP 4.10 calls for organizations to be supportive, open, and approachable to new ideas and foster a culture of creative thinking within their staff. They inspire employees to share ideas, suggestions, and innovative solutions to elevate the practice environment. Standard 5 is well-being. Pathway recognizes the importance of well-being. It has always been part of the criteria, yet the relevancy of this standard is on a whole other level now. Organizations have a critical responsibility to foster well-being of the team that allows the nurse to be their best possible self, strengthening their ability to adapt and overcome adversity. There is also a direct correlation between clinician well-being and patient safety and outcomes. Therefore, staff well-being and resilience are at the forefront of the strategic planning efforts of Pathway to Excellence organizations. Including it in the strategic plan ensures that it remains a priority all year round and that leaders assess workforce well-being periodically. Staff are active participants in the selection, planning, and evaluation of well-being initiatives so that they are meaningful and highly utilized. They also have input in creating schedules that promote a balance between work and personal life. Pathway to Excellence designated organizations have support processes in place to foster staff resilience and well-being that mitigate physical, psychological, and compassion fatigue. Nurses feel safe to self-report medical errors, knowing that they will be supported. Staff well-being is also safeguarded following adverse situations. Nurse leaders and the organization hardwire a culture of recognition where nurses are acknowledged for community volunteer activities, valuable contributions, and making a positive impact on others. Meaningful recognition contributes to reduced stress, positive relationships, and increases employees' sense of meaning in their work. Thus, it is practiced by everyone in the organization. Standard 5 includes 3 new EOPs. The concept for EOP 5.1 is for the organization to provide opportunities to raise awareness of mental health issues prevalent among nurses, available mental health services to address those issues, and evidence-based strategies to enhance mental well-being during work hours. Often nurses will wear a professional face, but be suffering from a mental health issue. Studies have suggested that nurses have higher rates of anxiety and depression than the general public. Some reports show 50% of nurses with burnout, which is an emotional response to chronic job stress with feelings of demoralization, cynicism, emotional exhaustion, and a sense of inefficacy. Burnout and depression are not the same thing, but being burned out does seem to increase the risk of other mental health issues, such as depression, substance use, anxiety, post-traumatic stress disorder, suicidal ideation, and suicide. There are many challenges to working in healthcare. Long work hours, exposure to human suffering and death, intense physical and emotional work, rotating and/or irregular shifts, and increased risk of exposure to disease and violence, to name a few. Experiencing these chronic challenges without relief puts nurses at risk. Programs to address mental health should offer comprehensive education and proactive screening for high distress and suicide risk, along with crisis intervention and critical incident debriefing with peer support. This gives nurses opportunities to come together, to share, and to discuss feelings. Peer support programs can be beneficial for a nurse in distress. Programs range from informal to more formal, while others offer telehealth or nurse coaching. It is important for nurses to learn and employ active coping strategies, as they have been associated with decreasing levels of burnout. A few strategies include progressive muscle relaxation, biofeedback, guided imagery, and transcendental meditation. Even with all the benefits of seeking help, research shows that nurses are reluctant or less likely to seek help for mental health issues due to stigma around treatment for mental health issues and consequences of seeking treatment. This graph is from the American Nurses Foundation 2022 Workplace Survey, where nurses were asked if they experienced the listed feelings in the past 14 days. Red indicates a negative feeling and blue a more positive feeling. We see this is overwhelmingly red. The top-rated feelings of the over 11,000 nurses surveyed were stressed, 68%, frustrated, 63%, exhausted, 59%, overwhelmed, 52%, undervalued, 47%, overworked and anxious, both at 45%, unsupported, 39%, and burned out at 38%. Mental health challenges often go unnoticed in the workplace. Therefore, it is important for organizations to recognize the warning signs of stress in employees and know how to effectively respond and support their colleagues in their mental well-being. When an employee's mental health is compromised, it can impact their ability to engage and perform at work with their best effort. Can you think of a time when you made a medical error during your career? Did you feel supported? The concept for EOP 5.8 is that the organization creates a culture where a nurse feels safe to self-report a medical error in the workplace. Medical errors are the third leading cause of death in the United States. When medical errors are reported, it helps to better understand root causes and implement supportive solutions. But there are barriers to reporting medical errors. One systematic review of the top 3 reasons to not report medical errors found they were fear of consequences, lack of feedback, and the work climate or culture. If a nurse is worried about losing their job or license because of self-reporting a medical error, or they do not get feedback after self-reporting, or they are concerned about being judged or not supported, this is not a safety culture. This sets the nurse up to be a second victim. An integrative review of second victim phenomenon found that a just culture with supportive leadership can decrease the fear of reporting medical errors. Other best practices are to improve education on adverse event reporting that involves positive feedback when self-reporting with non-punitive guidelines. And lastly, it should be standard operating procedure for healthcare organizations to have available associated peer support for the staff. I can remember one Pathway CNO sharing he is intentional to personally thank every nurse that reports a medical error or good catch. This is how a culture can change for the better. This graphic shows the Just Culture algorithm from the Center for Patient Safety. I want to point out a couple aspects of the model. Effective investigation of current practices and events, and a learning culture for staff and management. Notice there is no mention of punishment and blame. Fostering a culture and non-punitive environment may encourage nurses to self-report medical errors in order to support the organization in identifying root causes and making meaningful improvements. The idea for EOP 5.10 is that the organization uses support strategies to address the well-being needs of senior nursing leaders and nurse managers. Many of the Pathway EOPs really focus on the direct care nurse voice, their involvements and contributions to the work of the interprofessional team, etc. We do have a whole standard centered on leadership because it is the leaders who support, encourage, and advocate for the direct care nurses. It is important to remember and focus on the nurse leaders' well-being as well. If the senior nurse leaders and managers' cups are empty, they will be less effective in their leadership duties. So this EOP is not exactly about nurse leader retention. There is an EOP for that, but the nurse leader's well-being is an important factor to whether they will want to and be able to continue in their roles. This graph should look familiar or similar to one a few slides back. This, once again, is from the ANF 2022 Workplace Survey, sorted to show the responses from 487 nurse managers, asking if they felt any of the feelings in the past 14 days. Again, red are negative and blue are positive feelings. Of note, the percentage of nurse managers reporting the following negative feelings was higher than the total combined responses of all surveyed nurses for stressed, frustrated, exhausted, overwhelmed, anxious, and burnout. It is important for organizations to recognize stressors in the workplace that impact their nurse leader well-being and dedicate resources and time for leaders to engage in self-care practices. Nurse leaders serve as role models for their teams, and by being in an optimal state of well-being, they can be more present and effective in their roles. Standard 6 is professional development. Pathway to Excellence organizations recognize the importance of staff orientation, collaboration, respectful communication, and development in the delivery of safe and effective patient care. The foundation for developing competent and collaborative staff begins with a comprehensive orientation that includes individualization of learning needs and clinical experiences to allow smooth transition into practice with the support and guidance of mentors, preceptors, and other nursing experts. Pathway to Excellence organizations value and recognize the importance of lifelong learning, ongoing education, specialty certification, and professional development. They also focus on emerging nurse leaders and encourage nurses to share best practices outside the organization. There is one new EOP in the professional development standard. How many here have a poster or podium presentation at the conference? Look at you sharing your knowledge and best practices outside your organization. Also, who here has been inspired to find ways to share as a result of attending the conference? The concept for EOP 6.9 is that nurses are encouraged to share best practices with entities outside their organization. Whenever I think of this topic, I remember a nurse leader that encouraged and mentored me to always think of ways to share my knowledge through writing and presenting. Sometimes I would think during those conversations, I just want to talk about my day and not be suggested. That would make a great article. You should write one. But it was great to have someone believing in me and planting those seeds that I have some knowledge worth sharing. Fast forward all these years later, I have authored articles and made presentations, each time growing professionally. Some ways nurses could share best practices outside their organization include, but are not limited to, publish, submit an abstract, and/or present to an external entity, participate on an external board, mentor through professional nursing association or program, or be a Pathway to Excellence or ANA mentor. Organizations that encourage nurses to make professional connections beyond their organization foster their growth professionally to collaborate, enhance presentation, and refine communication skills to disseminate best practices. I am excited to see what Pathway nurses will do to share their best practices. I am also excited for this new manual and how the elements, both the new ones and the continued ones, when enculturated at healthcare organizations, can make a huge impact to patient care and the work environment. Thank you so much for attending. Any questions at this point? Also, please feel free to reach out to me via email. My email is on the screen. Thank you.